Cryotherapy is the application of cold to tissues. Cold therapy is used during the first 12 to 72 hours post-surgery or injury. The application of cold causes vasoconstriction, decreased arterial and capillary blood flow, and decreased edema by decreased leakage from capillaries into the tissues. Cryotherapy also decreases cutaneous nerve conduction, providing mild analgesia, and relaxes skeletal muscle, decreasing muscle spasms. Cryotherapy is also used later in recovery and for osteoarthritis patients following an active workout. Cold therapy provides superficial penetration, typically to a depth of 1 to 4 centimeters. Used for 5 to 15 minutes, 2 to 4 times per day. Cold packs are easy to make by mixing 1/3 isopropyl alcohol and 2/3 water in a double-bagged Ziploc. The cold packs can then be stored in the freezer. They can be made of different sizes, and they conform nicely to the tissues. Do not use cryotherapy for longer than 30 minutes at a time, or in patients with peripheral vascular disease, diabetes mellitus, or open wounds. Moist heat can be applied many different ways. Rice bags, buckwheat hull bags, cherry pit bags, and reusable gel packs can be warmed in the microwave. In addition, there are sandbags that are immersed in hot water to provide extended periods of heat application. Moist heat application provides superficial tissue activity to a depth of 1 to 2 centimeters. 104 to 113 degrees is optimal. Moist heat decreases swelling, pain, muscle spasm, and joint stiffness. Heat also promotes vasodilatation and increased local circulation. In addition, moist heat increases compliance of joint capsule, tendons, and scars. Heat is used after the first 2 to 3 days following surgery or injury, and is very helpful prior to a workout or rehab session, before massage, or before joint mobilization. Try to apply moist heat 2 to 3 times per day, 10 to 20 minutes per session. Do not use heat on freshly epithelialized wounds or scar tissue, and do not use in insensate areas. Massage is another physical medicine technique. Massage facilitates arterial, venous, and lymph flow, increases nutrient transport and removes waste from tissues, and relaxes skeletal muscle, decreasing pain and spasm. Massage also mobilizes tissues that are abnormally adherent to adjacent structures. When massaging a pet, move from distal to proximal. The duration and frequency of massage depends upon the patient's tolerance and the condition being treated. For edema, for instance, short sessions delivered frequently are good, 3 to 4 times per day. For fibrosis, the sessions would be longer, but less frequent, 1 to 2 times per day. Do not massage over open wounds, malignant tumors, infected tissues, or areas experiencing thrombosis or phlebitis. Therapeutic exercise is another category of physical rehabilitation. This category of activity is further subdivided. Passive range of motion involves the therapist taking the dog's limb through its full flexion and extension. The therapist does all the work. Assisted passive range of motion allows the dog to participate by pulling against gentle resistance provided by the therapist. Active range of motion exercises include sit-to-stand exercises, weaving, walking over cavaletti rails, as well as the use of resistance bands to encourage full flexion and extension of joints. Balance exercises can utilize physio balls and physio rolls, as well as balance boards. Wheelbarrowing involves lifting the rear quarters so that the dog uses and strengthens the front limbs. Dancing with the dog by lifting the front quarters and walking slowly forward and backward strengthens and stretches the rear quarters. Working with a dry land treadmill is also an excellent way to provide controlled and consistent use of all four limbs. Therapeutic exercise increases muscle strength, endurance, and coordination. It also decreases joint stiffness and muscle atrophy while improving nerve conduction. Hydrotherapy involves using water to assist dogs in recovering from surgery and injury, as well as building strength and endurance and improving neural function. Hydrotherapy can be applied via a whirlpool through swimming, as well as in an underwater treadmill. The biggest advantage to hydrotherapy is buoyancy, providing less force on the limbs. This allows for non-weight-bearing to partial weight-bearing exercise. The amount of unloading of forces on the joints depends upon how high the water level in relationship to the height of the patient. Water at the level of the tarsus relieves approximately 10% of body weight. Water at the level of the stifle relieves about 15% of body weight. Dogs in water at the level of the greater trochanter only weigh approximately 40% of what they weigh on dry land. Also, the lower the water level, the greater the drag on the limbs as the dog walks on the underwater treadmill. It's important to recognize that dogs work very hard when they are first working underwater. It's important to be careful not to allow them to overexert. Manual therapy in canine rehabilitation includes chiropractic adjustments, osteopathic manipulation, as well as joint mobilization. Chiropractic adjustments usually involve low-amplitude, high-velocity controlled thrusts that restore normal movement to joints that are experiencing some level of restricted movement. Chiropractic is classically focused on mobility of the vertebral segments in the spine. Joint mobilization, in contrast, involves several types of motion, including small movements applied in an oscillatory manner, pulsed stretches, sustained stretches, as well as sustained distractions. Joint mobilization is planned according to the range of motion through which the mobilization is applied. Manual therapy techniques are typically only performed by the therapist.